Welcome everyone to today's webinar, Remove the Barrier to Self-Service, Mosaic's New Patient Financial Experience Explained. I am Brian Zimmerman with Becker's Hospital Review. We'll begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I'm pleased to introduce our fantastic presenters today from Mosaic Life Care in St. Joseph, Missouri. Deborah Van Cleve is the Vice President of Revenue Cycle, and Christy Skeen is the Director of Revenue Cycle Management. We are also pleased to be joined by Mike D'Amelio from Simply. Thank you all for joining us. Deborah, I'll turn the floor over to you.
Thank you. Good afternoon, everyone, and thanks for joining. I wanted to start by just talking a little bit about Mosaic Life Care, just to familiarize you with our organization. Mosaic Life Care is a physician-led healthcare system. We're located in Northwest Missouri, about an hour north of Kansas City. We serve 35 counties in Northwest Missouri, Northeast Kansas, Southeast Nebraska, and Southwest Iowa. Our organization serves a population of approximately 350,000, and I might note we are the largest employer in our region, employing more than 4,000 employees. Uniquely, Mosaic also refers to their employees as caregivers. Our main campus is in St. Joseph, Missouri. It is a 352-bed certified hospital. We are a level 2 trauma center and the level 2 stroke center. We also have more than 60 hospital and area clinics offering urgent, primary, specialty, and emergency care. We newly acquired St. Francis facility from SSM in April of this year, and we rebranded that to Mosaic Medical Center Maryville. That is a 90-bed hospital and also a level 3 stroke center. They also have 4 rural healthcare clinics, one also in Bedford, Iowa. So we have expanded our span of control there. Just to give you a little bit of an idea about size, that brings our total certified beds to about 508. Currently, we have about 20,000 average yearly discharges, about 600,000 yearly clinic visits, and about 60,000 emergency room visits. One thing that might be of interest to you is that we are a past Malcolm Baldrige National Quality Award winner, and Mosaic is the only healthcare system in Missouri that's a member of the Mayo Clinic Care Network.
Thanks, Deborah. That was an awesome intro to Mosaic. I'm going to set the tone for what we're going to talk about today. We're going to start with identifying the gap in the patient financial experience. Then we'll move on to planning and executing a plan and talk about the success you've had since executing, and then we'll talk about what's next. So diving right in, it's often that hospital systems will be really laser focused in on clinical care. And, you know, from how people are greeted to they come in to the actual clinical care they get to the follow-ups. And then this financial care is sort of like this outlier or sometimes overlooked. And when you think about it from the patient's point of view, it's the first touch and the last touch. That's your first impression and last impression. And when you think about satisfaction and how likely are you to recommend, I mean, think about like when you go to a nice restaurant and the food's great, but the service was terrible. And that's your first and last impression. And that can really affect if you go back to that restaurant. And it's not much different here when we think about hospitals. Like, I think we think it in terms of clinical care and financial care, and they're really inseparable. I think clinical care, financial care together is patient care. So I want to kind of set that tone as we talk about today's content. And what I ask of all the audience members is that you really pull yourself outside of your title and your org and your role and really ask yourself, you know, what does your current experience look like? Is it on the left? Are you American Ninja Warriors to actually pay a bill through your system? Or is it a nice, soothing path and easy an easy ride to get to the end. And if you're somewhere in the middle, are you like, we're good enough? And how good is good enough? And for how long will that last? So really try and put yourself in the patient's shoes and have a perspective a real honest perspective on how you think you stand when it comes to patient financial experience. So let's start more of the conversation. And Christy and Deborah, when you went, what was your aha moment when you were like, hey, we got a problem here? And then talk to me about some of the goals you wanted to achieve to serve your community.
Sure. This is Deborah. I agree with your opening statement. As a business, our focus should be on healthcare service delivery. And I agree that we have to provide that quality of care, which we do at Mosaic. I think, though, also we must be fiscally sound. So I think for us, we needed to align our culture. And so our focus on patient financial experience is kind of what started our entire journey. I think the evolution of patients into consumers is a major shift, not only for us at Mosaic, but I think just for the healthcare industry in general. And I think this emerging kind of consumerism trend really extends to the revenue cycle and how patients are engaged in that financial conversation. I read a statistic recently that the patient share of hospital revenues climbed to nearly 30%. So that means healthcare systems kind of have this urgent need to focus on a patient-centric solution in order to kind of stem that rise of bad debt that can come from not meeting patient needs for billing transparency and affordability. So our goals were pretty simple. Our goal was, number one, to drastically improve that patient financial experience. Number two, reduce complaints, which was a historical problem. We definitely needed to reduce bad debt. And I think more simply, we just needed to kind of jump on the bandwagon towards the technology revolution.
That's perfect. I mean, I think there's a lot of health systems on the line right now that can relate to that setup and that story. I think we're all looking at some of those problems currently. So I'm going to jump ahead to planning and executing an experience. So as you started to chart this path, great, we know we have a problem. We know we need to catch up. I'm sure you started to look at staffing and internal solutions, and then eventually search for partners. Can you describe sort of your process around that, and maybe talk about the criteria for the partner search and some of the biggest challenges you've had actually starting to execute now?
Sure. Well, I think just maybe if I could back up just a little bit. I kind of talked a little bit about Mosaic winning quality awards, which we have been recognized kind of consistently for our clinical quality and also for our patient satisfaction in their health outcomes. We were always a top performer rated by Truven, JCO, CMS, and others. And I felt that we could totally compete head-to-head with some of the heavyweight health systems in our region. However, we kind of knew there was really an opportunity for improvement on the revenue cycle side of the street. So we developed a kind of a comprehensive 5-year plan focus on improving patient financial experience. So I think if you can envision revenue cycle functions as a big circle, our patient financial experience would be the nucleus of that circle. So our plan kind of included shoring up processes, some structural reorganization, but more importantly, kind of investing in deploying technology that could help us be more sufficient and enable us to monitor the improvement in patient financial experience. Kind of, as I said a few minutes ago, self-pay is increasing, which, I'm sure isn't surprising. So we had to absolutely be more efficient and effective in kind of more consumer-friendly in collecting those dollars. So with that said, one of our focuses was on our patient portal. Prior to Simply, we had a static portal, and I think Christy will go into this a little bit more in detail in a few minutes. But we had a static website where patients could go and kind of post a payment if they chose, or send in a paper check from a patient statement. So because our Mosaic is a sole community hospital, we're in a rural area in Northwest Missouri, our patient mix is majority Medicare. So our vision was to allow all patients, regardless of age or computer skills, to be able to access a payment portal, view their bills, make payments, or set up payment arrangements, kind of without the frustration or even any kind of foreknowledge. So what we were afraid of is that the majority of our patients probably wouldn't even know what a PDF file is, let alone kind of have the ability to open it and view some kind of static statement. So in looking for a vendor, we needed kind of a simple layout, something that even seniors or as well as new millennials would be satisfied with. So when we saw the Simply solution, I think the screen organization and the ability to click on the tiles was exactly what we had envisioned for our patients. No other payment portal was as simple or clear to the user. And Christy, again, we'll talk about this, but we even set up a focus group where patients, which included some of our own caregivers, were able to view a variety of statements, view a variety of web portals. And I have to tell you that the response towards Simply was totally overwhelmingly positive. So that's kind of how we came to Simply as a vendor.
Thank you, Deborah. I really like one of the key takeaways of what you just said is, you really tapped into your community, right? You knew you served this Medicare, Medicaid. You had a lot of older demographic, and it was like, what we have to do is make this easy. So let's find a partner that can make it as easy as possible. It's a great sentiment. Really important. It's that kind of simple, right? I'm going to move forward where we start talking about the success that we're seeing here with Mosaic. And before I do that, I want to talk about just like the expectations set by retail. Patients really are consumers now. And as you fight for their dollar, you need to match what the expectations are. And I think we can all relate to like an Amazon or a Netflix. I want it when I want it, how I want it, and personalized to me anytime, anywhere, right? So, as you fight for their dollar, you need to really think as a consumer brand. Think like an Apple. You need to think like Amazon, think like Netflix. And I think we have this perception that like healthcare, it's different for us. They don't want to pay. It is a little different, but statistics show 85% of patients, they do want to pay their bill. There's a lot of like pride in paying for a service that was provided to you. But only 20% say they understand and it's convenient. So when you put these barriers up, people are just like, forget it. Just let it go to collections, or I'll deal with it when you come chase me down. And that's sort of the status quo that we live by today. It's just, we can do better. And when we look ahead to other industries, everyone else has this figured out, right? Consumer, credit cards, car loans, student loans. And then you got healthcare. Like, what's going on here? We got to do a better job. There's a great opportunity to close this gap. And with that, I'm going to pass it over to Christy, who's going to talk about the journey and their overall experience that they've had and the results, starting with paper, which is often the first touch, which is a great gateway to digital. So with that, Christy, I'll be quiet.
Thank you, Mike. I appreciate it. What you're looking at today on the screen is definitely a side-by-side version of what our historical and legacy patient paper statement looked like. We took that document during our journey of sitting down with the patient and understanding what their needs were, along with our customer service representatives that are listening day in and day out about what the patients are asking, what are the questions that they're they're calling in for that we could potentially help build the online portal and design to drive the patient to the portal and less of a paper footprint. So the call out here on this slide is where we have replicated multiple times of where the patient can access our portal. We definitely want the patient's experience to be self-service. We definitely do not have an opportunity to always call during the workday when our customer service center is open. And so we definitely wanted to provide and expand those hours of operation to the patient online. So the paper statement definitely has become a thing of the past at Mosaic. We still have it. Some still generate. When we went through the design, it's definitely better than what we had before, but we definitely have surpassed that model and have definitely moved to the online piece. I think when the next slide definitely shows you what the patient asked for, which was ease of logging in. No one wants to have their iPhone in their hand and they have to remember a username and password to log in. We worked alongside with the folks at Simply to help us design how can we make it happen for the patient to easily access their records securely without a username and password. So this particular slide shows you what the patient is experiencing. They need their account number, their date of birth, and they're viewing their bill. The account number is something that we've designed that is only 6 digits, and it's very easy to remember for that patient, and it's unique to that patient for their lifetime. Definitely patients are experiencing a much better workflow for them, and we're also reducing calls to our call center. This was the #1 call for our customer service agents for I forgot my username, my password, I don't understand my bill, and now the patients can log in and easily access those records. So definitely our focus here was self-service and ease of actually entering into the portal and getting your access to your records. On the next slide, when the patient actually enters into the first part of the portal, they are experiencing a consolidated billing view, and we break it down by patient and by location. So the patient can easily see all of the locations in which they were being treated and what each bill item is. The patients definitely asked for the separate locations because when we send them a consolidated bill, it was in a summary view, and the patients were really struggling with how to understand their statement, what they were being treated for. Again, another very high volume call that would come in, and what am I even being billed for? What was I seen for? What date was I seen? They're sometimes wanting to match that up with the explanation of benefits that they get from their payer to validate that they actually need to pay the bill. So here, each patient has their call to action listed by location. The patients love the option of being able to drill down into these tiles, as Deborah mentioned before. They can see the copy of their image, the statement image, and they can also get an itemized bill here. Very important for patients, especially at tax time. We would get calls all the way up until the very end of the last day to file your taxes. They want those itemized bills. They now, again, can self-serve and be able to access those online at their convenience. So this was a huge win for our patient population.
If I could just interject Christy, if I just can interject real quick. I think the important thing about that last slide was the word Christy mentioned was consolidation. And I know in healthcare, one of the biggest challenges for patients and for that patient experience is receiving multiple bills from multiple different locations. As we know, a lot of the physicians will outsource pro fee, and that was a big complaint of our patients. So I was notoriously calling this Simply Portal our one bill portal. So our objective over the next 5 years is to bring all of those bills into this one bill portal, so that would eliminate the need for patients to receive statements from multiple locations. Go ahead, Christy.
Great point, Deborah. Thank you. On the next slide, this is definitely depicting one of the best features that we've received feedback from the patients when they take their survey online, post their experience. We are definitely seeing a huge win for the patients to be able to set up their own payment plans. One of the features that Simply offers is for the provider to be able to actually set up parameters for payment plans that you would allow the patient to self-serve. And definitely this has been one of the biggest drivers of a cash flow increase. We're seeing an astronomical rate of patients setting up short-term payment plans and repaying those balances very timely. And the default rate is less than what we were experiencing prior to the online experience. And then this definitely takes, one of the main points I want to make here is it takes the element of the human asking for the money out of the equation. So this has drove quite a bit of our cash directly to our bottom line, just simply by taking that human element out of the equation. So the patients are absolutely loving this portion of the experience. Mike, I'll turn it back over to you.
Sure. I think we can both probably talk about this. We've seen a 50% growth in the payment plans year over year, and 52% of them were done via self-service, and 70% repayment rate. So what does that really mean? It means patients want and need payment plans, so you're providing that, and they're able to do that on their terms, right? I think we can all relate to like having to call, even like the garbage company missed your pickup, and you got to like take time out of your day at work because they only have certain hours you can call. And now you're in healthcare asking them to do that and have a very personal conversation about their healthcare and finances, either in their car or sneaking into a conference room at work to do it. But here, they're able to do this, in their jammies at 2 a.m. if they want. But the convenience of it and the need for it, and it's not like, hey, more payment plans are bad. They're repaying these. And when I look at these numbers, I go, how many of these people would have ended up in collections? So that's the real noble aspect of these stats. Deborah or Chrissy, you want to talk more about that, or should I move forward?
I think we can move forward. Great point.
Okay. Well, and then 81% of self-service payments. I mean, that was one of the main goals that Deborah had mentioned earlier, right, is to just make it easy for people. And when you have 81%, I mean, that's an incredible number. It says that this is easy to do. So I'll move forward. This one I think we should all talk about. Oh, yeah.
Yeah, one point on the 81% of the payments for, an online source. One thing that we did experience, which we did plan for, however, I don't think we planned for as successful as it has been, which is the patient paying online has reduced the paper checks coming through our lockbox and has in turn reduced our bank fees. And so that is something that we are definitely tracking and monitoring. The less we have to pay just to process a payment is a win.
Right, like the more you can drive to self-service, the lower your cost to collect, right? So it's really a win-win. The patients are loving that it's available to them, and you're having a reduction in cost.
Well, it's not only that, Mike, but when we talk about improvements, this is a drastic improvement. So when we looked across the board to our prior system before we implemented Simply, we were collecting probably in the 90th percentile range of paper checks via paper statements, and maybe only 10, 13% were online activity. So with that said, our collection rate for pure self-pay was 5%. I mean, really dismal. So these statistics are just staggering. We've significantly improved our cash position for self-pay, including pure self-pay and balance after insurance.
Wow, that's amazing insight. Thank you for sharing. I'm going to jump ahead to the mobile statistics, which are staggering even by Simply standards, to see 60% mobile payments completed online. And I know as we put these slides together, we spoke about this, and I think we really tapped into thinking about the community you serve. We found some data and studies that show that, like, rural communities, desktop computers are expensive, laptop computers are expensive, internet's expensive. Phones are often like, hey, we'll give you the phone, just pay for the plan and you get unlimited data. So the fact that there's a high mobile shouldn't surprise us, but I think going in, you'd expect maybe 20 to 30%, but we're seeing 60. So we're really delivering on the way we engage too, right? The experience needs to be ubiquitous, regardless of device. And I'm going to jump ahead. It looks like there's a little lag on the slide, so I'll give it a second. But we're going to talk about payments from email. And
Mike, I can take this one if you don't mind.
Yeah, no, I'd love that. Great. Go for it.
So for the approach for our overall strategy, we definitely did not just think of this from a back office patient billing perspective. We had an opportunity to tap into the pre-service group at Mosaic, and not only when we launched this product and the new services, we also engaged our financial clearance division. And during that financial clearance division redesign, we helped them understand what the patient's experience is going to be online or when they called a service agent. And we had an opportunity to launch the email campaign. And during that campaign, we also had the financial clearance division help us with making sure that they're capturing accurate email data and promoting to the patient when you receive your bill, here's how you can engage and pay that if they can't pay pre-service. And so we've seen a huge increase and a huge lift once we launched the email campaign to the patient. Definitely huge numbers here for us. So with 46% of our patients paying via email, we are definitely ready for the next step. This has been a huge win for Mosaic.
Awesome. Awesome. Again, I do apologize if anyone's experiencing a lag on the slides. I'm going to start talking, and it should catch up here in a second. But it speaks again to the demographic, right? Like, hey, we need to make it easy. But then we see this huge mobile adoption and then people paying from email. I think we have this preconceived notion that, like, older people aren't making payments online. Well, it's just not true. I mean, there's a ton of stats to support this. And when you look at the consumer average, I mean, sure, it's lower as you get to the older demographics, but they're online, they're paying. And I know, my mom's online, my mom's on Facebook, it's scary. So these people are using their phones, they're paying through their phones. So this perception that they're not on doing it is just false. And that's proven by some of the stats we're seeing.
Yeah, and Mike, I have to admit we were a little surprised about this data. I don't think we quite expected that type of activity, so we were pleasantly surprised, I guess you could say.
Yeah. I'm going to jump ahead. Christy, I think this is a great slide for you to talk about the decrease in staff-assisted payments. I mean, think about what you can do with 40% more time back to your staff. It's got to be awesome.
You bet. The opportunity to decrease their time in which they're being reactive to a patient and their need is a thing of the past. We definitely, like I said, we have re-engaged those caregivers that were taking a phone call post-service, and we've moved them further upstream into the revenue cycle process. And they're now sitting in our financial clearance division, and they're taking care of pre-service functions that would be considered prior auths and estimates and financial counseling, and talking to the patients before they even have a bill. So during those conversations, we're educating our patients. That's one of the things that we were hearing. I have no idea. We in healthcare take it for granted that we know what the patient needs are and that they know what an EOB is. They have no idea. We are definitely in a complex environment with the billing process, and we definitely need to break that down for the patient, and that's exactly what the model is for Mosaic. We are not taking anything for granted and allowing things to get to post-service any longer. These patients are being engaged much further up in the revenue stream.
And I want to kind of give kudos to Christy for her vision in this realignment, because we did take caregivers. We created a patient financial clearance unit and also an insurance financial clearance unit. And I think that's what has been driving the majority of our success.
Awesome. I'm going to leave this slide for you guys because this is just my favorite slide of the whole presentation. There it goes. It looks like it's still got some lag, but Deborah, you want to lead this one? Okay, go.
Deborah, go ahead.
Yep. So if you're not familiar with an NPS score, that means Net Promoter Score. And when you take a survey, there'll be one leading question which begs to ask, would you recommend this facility or this organization or this company? A lot of sales teams use that to kind of judge their success in client delivery, but Simply also has a portion where patients can then react to a survey. And we have received a overall Net Promoter Score of 32, which is pretty phenomenal. I mean, Mike, I think go ahead and chime in, because I think you said that this even beats Nordstrom. Is that what you said?
Yeah. I mean, to your point, NPS scores are really, you can't fake an NPS score, because the way it's calculated is you go through a 1 through 10, right? And 9s and 10s are subtracted from the 0s and 6s. So it's really a true score of how you're doing. So when you compare it to other brands, right, like Nordstrom, like paying your bill at Nordstrom versus Mosaic, and you're ahead of them, that says something. And even deeper than that, for me, it's like, you think like rev cycle folks can affect patient satisfaction this much, right? Like you have this much power, it's patient satisfaction, not just ROI, right? And you don't got to have one or the other. You can have them both. So to me, like, this is why I joined Simply. It's why I work here. It's why I'm still passionate, as you can probably tell by my tone. And, you know, the brands that have great NPSs, right, they obsess over the user experience. And that's what Mosaic's doing here, and the numbers show. So, again, my favorite slide.
Yeah, and this is a way that we're also, remember I talked earlier about how we're going to monitor our success, and this is one of the ways in which we can monitor our success in patient financial experience. And I think considering where we started, this is phenomenal. And, to coin Christy's phrase, this is a huge win for Mosaic.
Absolutely. So I'm going to turn it back to you guys and talk about what's next. And that will probably take a second to update here. I'm watching live, but the slide should update here in a second.
You bet. This is I can take that. The two big pieces for us on our roadmap are that the patient has the same experience post-service with Simply on the pre-service end. So we will be launching a partnership with Simply to provide estimates pre-service in the same format that they would receive a bill notification in post-service. So what I mean by that is we will be talking to the patient during our financial clearance conversations, and we will be providing them an estimate. And if they can't pay over the phone during our pre-registration call, we will notify the patient that they will receive an email notification or a text message of their estimate, and then they can pay from their mobile device before their service. We definitely, the goal here is that the patient has again, the same experience, and they're going to the same portal to drive, obviously the cash flow, but also drive the patient's experience even further. We definitely want to continue to monitor that NPS score, and that's where we're going to get the biggest bang for our buck. The text messaging, right now we have email notification turned on. We are moving towards text messaging. It's a little bit more complicated and complex. Our legal department likes to keep us in check. So that is one of the big steps for us in kind of a notice of admission and having the ability to send text messages that the patient's bills are ready. And we definitely are excited for that. The email, turning on the email notification gave us a 40% lift. We are definitely hoping for an even bigger lift when text messaging arrives. Deborah, is there anything you'd like to add?
No, I think those are well within reach, and these are not future goals. These are something we're beginning to work on as we speak. So we're very excited for that next step. And one statistic that I don't know if we mentioned, or maybe I missed it, but I don't know if we talked about time to payment. We saw average time of payment from bill date about 45 to 50 days. With Simply, our average time of payment is now 7 days. I mean, you can't argue with those statistics. It's pretty phenomenal. That's all I
completely agree. I think one more thing that I'll mention that I did forget, which is right now we are calling the patient during our pre-registration conversations, and we will be, again, partnering with Simply for their online pre-registration workflow. So, again, the patient can, have the same experience during their payment workflow, but they'll also be able to update their demographic information and complete their estimation and pay for their estimation pre-service. So that is another great win for the patient.
That's right, and it really, this completes like the bookends we talked about in one of the early slides, where it's your first touch and last touch, and the fact that it's the same experience, it's not disjointed, it builds that trust and closes the gap, really. So I'm excited to see what comes next, and working with great partners like you. It's great because you drive us and we can drive you. It's a great partnership. I'm jumping ahead to closing thoughts. Deborah, I think you said these great. So I'll let you take the slide because you said them best.
Well, I don't want to read through the slide, but I think the measurement for success probably stands out as one of the better closing thoughts. And I think we've been able to measure our success, but also we now have the ability to kind of measure that patient financial experience. So I think that's pretty huge. And I would also like to offer up kind of maybe some advice. So as we embarked on this project of implementing the Simply portal, we partnered with our marketing and PR team. And in fact, one of our marketing directors was a significant part of our project team. And I think that was a huge win for us, and that provided us a lot of insight from a patient perception perspective that we may not have had that marketing has. They monitor our social media, they monitor patient complaints, so they kind of had a little bit better idea than maybe we had on patients' perceptions. What do patients really want? What are they looking for? And how can we be successful in this project? So that would just be kind of a takeaway. If you're on the phone and you're kind of considering this type of a portal alignment, that's just kind of a piece of advice I'd like to leave with you. That's it.
That's awesome. With that, Brian, I'll flip it back to you because they've heard us talk enough, so I'd love to hear from our audience and what awesome questions they have lined up.
Great. Thank you so much for that fantastic presentation, everybody. And we will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we'll try to get through as many questions as we can. So the first question here I'll ask is, are you able to offer a prompt pay option online? I think, Mike, maybe if you want to grab that one.
Sorry, I was on mute. We don't have that built into the system at the moment, but we are. It's one of the things we have a design partner with, and we are actually doing right now. So it's currently being tested. So I guess the answer is yes. It's just not currently live with anyone.
Great. Thanks for clarifying that. And the next question we'll take here is, what NPS did you have pre-focus on patient self-pay?
Well, that's interesting because we didn't really have that opportunity. So we had a call center, but it was mainly customer service center on inbound calls. We did have the ability to record those calls, but we didn't have the ability to capture surveys. So this is new for us. But by collecting the score that we had, knowing that we beat other major retail organizations, I was happy to know about that.
Great, thank you. And we've got a bunch of great questions coming in. Really appreciate all this engagement from our attendees today. And the next question I'll take here is, so have you integrated this bill pay experience with your patient portal?
Go ahead, Christy, I'll let you take that one.
You bet. So when the patient actually lands on our Mosaic page, there is a Pay My Bill link, and then it automatically routes them to the Simply portal. If the patient is in their actual portal for their health records, there is another link there as well that is the same link, Pay My Bill, and then it routes them right over to the Simply platform. So it's in multiple locations in which, depending on what the patient is searching for on our webpage, the link is there and available, and they can pay right from there.
And it is branded Mosaic, so the change in your URL is seamless to the patient.
Great, thank you both. And the next question here is, this attendee asks, can you talk about the integration with your primary revenue cycle system? For example, how do the payment plans get entered into the revenue cycle system?
So I can take that one, Deborah. The current patient accounting system that we're using, we are not posting back any formal payment plans into that system. It's not the best ideal state. What we are doing is we are sending file transfers back and forth between Simply and our early out vendor. The early out vendor is who is handling the messaging and the dunning levels for the statement cycles. So if the patient does set up a payment plan on the portal, it hits a certain dunning level message that transmits back and forth. So they stay in sync, our early out vendor and Simply, and then everything gets fed back into our patient accounting system from a payment perspective and comments and anything that's coming back and forth. So we have some bidirectional HL7s and data extracts that are managing all of that. So we're not doing any kind of dual entry with the Simply payment portal and our patient accounting system.
Helpful to know there, thank you. And the next question we'll grab is, so when you say you went away from paper-driven statements, how does that work? Do patients opt out of getting statements if they choose?
Yes, they absolutely can opt in and opt out on the Simply portal. They get to manage that, and then that message comes back to our early out vendor, and Simply is who is driving the statement messages to the statement vendor, and the patient does all of that self-service. So we're not maintaining opting in or opting out in our patient accounting system. It's all driven by Simply.
Excellent. And the next question we'll take here is, so this attendee asked, you mentioned tackling pre-service next. What is your current process like, and what are your goals going into the next phase?
So our current process, we've just completed a redesign during this patient financial experience, and Deborah did allude to and mention we have split the traditional pre-registration workflow into two modules. The first one is the insurance financial clearance process. So that work is being done by caregivers that are just managing insurance eligibility, quality assurance, patient demographics, the estimates, and authorizations. Once the encounter passes through the patient or the insurance financial clearance, it moves on to the patient financial clearance team. That team is responsible for reaching out to the patient to ask for the payment over the phone. The new model that we're looking for is that the patient, we take the element of asking for the money via the human, and they actually have the ability to do that online with Simply. I think the big, huge wins here are we're not touching every single encounter during the pre-registration process. We're working by exception. So we're only touching the encounter during the insurance financial clearance process if there is a problem. If it needs an authorization, we will touch it. If there is a problem with insurance eligibility, we will touch it. If those are no, it bypasses the insurance financial clearance process and moves straight to the patient financial clearance. If the patient owes nothing out of pocket for that visit and it's passed all of the insurance financial clearance processes, it automatically moves into just an appointment reminder workflow, and we don't even touch the encounter. So we're automating those processes.
Thank you so much for breaking that all down for us. And the next question here asks, is the Simply web portal connected with a direct link or API with your existing EMR system so the payments are reflected in real time?
The payments are actually coming through. It's not API, so it is a nightly feed. So when the patient makes a payment on Simply, it does reflect immediately online. In the billing system, it comes back and it posts the next day. So it's not an API feed at this time.
Thanks for that clarification. And we've got another clarification question from an attendee. The attendee asked, does Simply process your statements? Yes. We use Simply for our statement vendor. They were the ones that actually helped us design those, and they're actually sending those statements out on our behalf. Wonderful. Appreciate the clarifications there. And the next question we have is, so what were some of the barriers or challenges you had to overcome internally before beginning your new strategy?
So I think we were pretty lucky because it was the goal of the Mosaic Executive Suite to enhance and improve the revenue cycle. So when I came on the scene in July of 2016, I had a little bit of a carte blanche, I think, because I think there was a large appetite for improving the patient financial experience and kind of building the revenue cycle into a best-in-class organization. So I had the support of the C-suite, and I think once the overall 5-year strategy was completed, it was well received. And because we had gone to great lengths to look at the 5-year strategy in terms of what are we going to do operationally and how are we going to improve ourselves using technology, but we also included the financial portion of that, which was return on investment and how are we going to look as a revenue cycle organization 5 years into the future, and what kind of a net margin impact are we going to have on the organization. So I'm proud to say that we're meeting those financial goals. And not only that, but we are on target to make more than $20 million of a net margin impact in a positive impact to the organization as a whole, all while improving our technology and kind of moving forward with our best-in-class process.
Appreciate that. And those are going to be all the questions we have for today. I'll throw it back to the panelists one last time to see if any of you have any final thoughts to share with our attendees.
Go ahead, Mike.
Just from the Simply side, I want to thank everyone who attended, and I hope we delivered a valuable information and a good conversation around patient financial experience. Thanks for joining.
Yeah, and I would add to that, thank you very much. Appreciate that. I'm a believer in networking, sharing success, and sharing the wealth. So if anyone has any specific questions or would like any type of guidance, I would be happy to answer those questions as well.
Wonderful. And that will conclude our webinar for today. I want to thank Deborah, Christy, and Mike for their excellent presentation and Simply for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.